Hi, my name is Dr. Richard Gringeri. I'm the founder and director of the Human Engine Clinic in Santa Clara, California. We've helped a lot of people with diabetes, and one of the questions I'm asked often by patients is why I'm so antagonistic toward the standard medical approach to diabetes. And I'm not even sure I know exactly what the standard medical approach is, except that when I talk to patients who come into my clinic who've had diabetes for anywhere from 5 to 10 years, what they tell me is that when they were first diagnosed with diabetes, they were put on one pill. And that one pill was enough to manage their blood sugar and keep them in a very nice normal range for a while. Usually 6 months, a year, maybe 2 years later, when they go into their doctor for a checkup, their sugar's been out of range for a while, and now they need 2 pills a day to keep their sugar in a normal range. And that goes along well for a while, and eventually, when they go back to their doctor, they end up on 3 pills a day. And then another diabetes medication is added. Somewhere in there, as time goes by, usually also the patient develops high blood pressure, high cholesterol. So many times I meet a patient who, when they were first diagnosed with diabetes, were on one pill, usually metformin or glucophage, same thing. They were taking 1 pill a day when they started under care, and 5, 6, 10 years later, they're on 3 different medications for diabetes, 2 or 3 different blood pressure medicines, cholesterol medicine, and many of them have other complications as well. So it's very obvious to me that with diabetes treatment, even with treatment, patients continue to get worse. Another example of that. A woman asked her 2 children who haven't been to the doctor in a number of years, they're in their 30s, they haven't been to the doctor in a number of years, and they're identical twins, to go to the doctor and have an examination. The first twin goes in, and he comes out and he says, the doctor just diagnosed me with diabetes, and he put me on 1 metformin a day. And the second one goes in, and when he comes out, the second twin says, you know what, the doctor said that I also have diabetes. And he put me on 3 metformin a day. Now, why would he put one brother on 1 metformin and the other brother on 3 metformin? The answer is that one of the brothers, the brother on the larger amount of medication, his blood sugar was much worse, and he needed a higher dose of medication to manage his blood sugar. So the bottom line is, if you start off on 1 medication and eventually need 3, what that's really telling you is that you're continuing to get worse. You're working hard, you're spending your time, you're spending your money, you're taking your drugs, and your situation continues to get worse. I have a patient in my clinic who told me that every time she would visit her doctor, he would remind her that diabetes is a slowly progressive disease, and no matter what she did, she was going to continue to worsen and worsen, and she could fight it, she could work at it, but eventually it would get worse, and eventually it would take her life. Now, my viewpoint is significantly different. I find that patients come in and they're on 2 or 3 diabetes medications, a couple of blood pressure medicines, and oftentimes 1 or 2 cholesterol medicines. And after a number of months in our clinic, they're usually their bodies are usually working well enough that their doctors have taken them off most, if not all, of their medication. It's not unusual for me to work with a patient who, within 6 months to a year after starting care, is off of all the medication he was on when he came into our office for treatment. So my answer to the question, why are you against the standard medical protocols for diabetes, is that they don't work, and that there are things that can be done to get your body working again and to get your diabetes under control.